But the interesting part is the first message that the doctor told me at the hospital after I was ushered out from the operating theatre was a message that he said that you are going to be, are you aware that you will be having medication for your life, or life medication? So I thought that was a very depressing message.
Okay.
So at that moment in my head, I was thinking, no, I'm not going to do that. I'm not going to be dependent on medication for the rest of my life. I think there are ways that I think that we should be able to overcome this. After I was discharged from hospital, we took effort to do our own research to find a holistic doctor. So what we did was that we found doctors in the US, we researched for doctors in Singapore. But eventually we came to one conclusion is that, so here's another doctor that tells me that what I believe in is that you can have natural therapy and you can go through a holistic treatment where you can slowly move away from this Western medication and rely on yourself and your own discipline and your activities to heal within yourself. But as we understood that, all these tests is to really determine the root cause. We want to find what's the underlying factor that's causing all these diseases and all these issues, and to really understand and solve it from the root cause. And once you find it, you solve it from that level. I don't think you will get that in any other hospital or clinic. I think my energy level is much higher. I thought I'm more productive at work generally than before. Definitely my energy level has improved, so I'm doing more than I was supposed to do. I can stay awake, more alert at more times. So those are the kind of things that you can feel. But I'm also very happy with the way my blood cells have improved. I think that's another testament to my own medical condition. I believe strongly that there is something else that people are unaware of, that if you do a bit more research and you spend a little bit more time, that you can find out. So for a lot of patients out there, I think you need to understand your life priorities. You need to make a commitment that you want to improve yourself. So it started just one morning in April last year, 2025. So in April 2025, what happened was that in one particular morning, I woke up. I felt a little bit of a pain on my chest. I was having cold sweat. So I couldn't really walk as normal. I thought it was just a normal pain on my chest. So I went to a normal outpatient clinic, which happens to be just at a clinic nearby house. After visiting the clinic, they did an ECG. Then they told me it was an emergency. And I need to go to the A&E ward in the hospital. So I took it quite casually. I went back to my apartment. I had a bath. I had some breakfast. Slowly, then I took more than an hour, and I slowly took my time to the A&E department. So even at the A&E department, I had a doctor's reference letter. So I was quite surprised because as I passed the letter, they took their time, the ECG. And after that, immediately the emergency procedures occurred. So I was taken a bit by surprise because I didn't expect it to be something so serious. I could still walk, I could still breathe normally. Just a bit of chest pain and cold sweat.
But at the clinic, they didn't tell you what was your condition? They just said it's an emergency.
It's a heart issue, but I still didn't know that it was so serious. I thought it would just be some treatment or some medication or something. I took it quite lightly. So even at the hospital, I took it quite lightly until the moment the emergency procedures came about. So all the doctors rushed in, the assistants, the hospital assistants came in, and they started to do. Everybody was in such a hurry. Somebody taking a blood test, somebody telling me this and that, and it was all happened in such a quick moment. It was really like what you see at an emergency, like an accident emergency, and I was taken aback by that.
But you are feeling okay.
I'm feeling okay. So that's why I was a bit surprised.
Correct.
At that moment, actually, I was feeling much better already. But then somebody told me that my heart is one of my vessels it's not working very well. In fact, my other two vessels is still just performing about 35%, and one of my vessels is already gone. So I was like, oh, what's happening? And they needed to do a stent operation immediately. So I was ushered up to the operating theater almost instantly. And then they did the stent operation immediately on me. And when they pushed me out from the operating theater, the first thing that the doctor told me at that moment was, did you know that what you went through? So I said, I thought I had a heart issue. But the interesting part is the first message that the doctor told me at the hospital after I was ushered out from the operating theater was a message that he said that are you aware that you will be having medication for your life, life medication? So I thought that was a very depressing message. So at that moment in my head, I was thinking, no, I'm not going to do that. I'm not going to be dependent on medication for the rest of my life. I think there are ways that I think that we should be able to overcome this. That there could be some natural therapy, natural healing methods that we must have it in Singapore or somewhere. So after after I was discharged from hospital, we took effort to do our own research to find a holistic doctor. So what we did was that we found doctors in the US. We researched for doctors in Singapore. But eventually we came to one conclusion, is that most of the Western doctors, while some of them preaches holistic treatment through supplements or through other natural therapy, eventually they will still move back to medications. So they are still very much trained or taught in Western medicine. So they have certain paradigms or certain beliefs that is very hard to change. So they will still squeeze back to the Western. So they may have some supplements, but it's still not a holistic kind of treatment. Then we went to the other frame, which are people, they are nutritionists. So they preach nutritional supplements and things like that. But we also realized that they are not trained in medical. So they are not doctors per se, so they can't really tell you, these are the medication that you should remove and things like that. They are not qualified in that sense. So we realized that just totally believing in them could also put yourself in danger, because you would then move away from medication, but you take the supplement. So how can we find both? A doctor that can actually merge both of these together. So we search. And after, I think, a few weeks of, my wife was doing the homework for me, fortunately. After a few weeks of search online and getting testimonies and reading online articles, we finally found Heal Within. So we chanced upon it. We read through and we realized that here there is a doctor who is trained in proper medication, who's a proper doctor, qualified doctor, who believes in a holistic approach, who believes in natural therapy. So we made up our mind and took our chance. So we applied for a visit here to find out whether what is written online it corresponds with what we will actually go through during the treatment. And on the very first visit, so we went through the whole test and all medical tests. And after that, when we meet with Dr. Lee on that very first visit, we were quite happy with what we hear, because we finally chanced upon someone who totally we can trust and who can believe in what we felt as well, that there is a natural way that you can heal, which do not need you to rely on medication. And certainly it goes back to the same message when I first when the doctor that pushed me out from the operating theater said that you got to rely on medication for your life. So here's another doctor that tells me that what I believe in is that you can have natural therapy and you can go through a holistic treatment where you can slowly move away from this Western medication and rely on yourself and your own discipline and your activities to heal within yourself. There's some very important things that we thought that Dr. Lee did. Firstly, the medical examination was very thorough. You don't just go in and just take a bit of blood test and you do something. I think that was very thorough. So we wanted something to be very thorough. And of course, the first visit, we thought, why do you need to do a saliva test? Why do you need to do so much tests? But as we understood that, all these tests is to really determine the root cause. We want to find what's the underlying factor that's causing all these diseases and all these issues, and to really understand and solve it from the root cause. And once you find it, you solve it from that level. I don't think you will get that in any other hospital or clinic. I think if you have heart disease, generally you'll be given medicine to solve just the heart issue. But the heart disease didn't just appear like that. It probably came because of some other reasons. For me, I realized that even having toxin in my body, even having metal particles like amalgam on my tooth, or things like that, actually could potentially cause, because I had a high metallic level in my blood. So these are things that I don't think the doctor would have gone so deep, a normal doctor would have gone so deep. Or you can't totally blame them, but I don't think it's part of the SOP or the procedure, standard operating procedures for them to really need to go so deep in order to find what's the underlying cause. So if you have a heart problem, they'll just treat your heart. But the heart problem didn't just appear like that. It is because of something else, something else, and something else. So if we can find what is that problem, then I think your heart will be able to heal naturally. So I think going through this whole process, well, it seems more tedious, but it's definitely the whole journey is more worth it. It's just like, you're not good in your studies, but you're not good in your studies not because you're just not good at studying. It might be because you might be taking a longer time to read, or you have a certain understanding issue, or maybe you just have attention span issue or something. We need to find what's the reason, then we can solve the problem of not being good in studies. So I think that's the same approach that Dr. Lee facilitated to help me understood that, this whole process, why are we doing so much tests, is in order to find out what is the root cause. And I think that helps me to, once I identify the problem, and of course it could be not just one problem, it could be a list of certain problems, it could be certain eating habits, dietary, could be lack of exercise, could be a lot of things. But I need to know what it is so that I can solve it from that angle, and then it would solve my heart issue altogether.
Exactly, and then also to prevent the recurrences, because if the switch is not found out what the switch is, then that light will keep on turning on. The plaque would keep on accumulating over there. So I don't know if you probably Dr. Lee explained to you. It's so that they put the stent in all three vessels. They put the stent. Just one, fortunately. Although the other two wasn't so good as well, but I was told it's still relatively okay. The one that they put in, what was the level of blockage? I think it was left with 0%. So completely. Completely. So I was surprised. Okay. So then if that happens, and then it was just put a stent, but the trigger was still there. The progression was still there. It could be a recurrence. Exactly. It could return if I just take medicine. I mean, I could solve I could be relying on medication. The rest took the advice and took medication for the rest of my life. Or I found out it could be, but I could be still eating wrongly. I could be still not doing things right. There could be still a lot of things that I'm doing wrong that I will still come back for another stent, and a third stent, and a fourth stent, because I've heard some of my friends who had 4 or 5 stents in their body. So is that something I want to go through, or is there another method? So I decided that there's some other thing I can do to stop this process. Stop the progression, exactly. Wonderful. I think trust is very important. I think back in Singapore, I feel that most of the doctors, they only have certain beliefs, that is, you have to go through this treatment, and this is the only approach. You have to rely on medication. So even after the surgery, we also have a hospital appointments, frequent one. I think initially once every 2 weeks, and then became once a month, and so on and so forth. But we have to visit the doctor. And every time I go back to the hospital for that hospital regular visit, the checkup basically, what happens was that the doctors still look at my cholesterol level. And despite us reducing our cholesterol level by almost 50%, so I've improved by 50%, he was still a little bit pessimistic in a sense to me. It wasn't any way of encouraging, hey, you're doing the things right, you have quit that 5 things, you have changed your lifestyle. It wasn't something encouraging. So he was in fact wanting to inject us, so with more medication, so that to bring down cholesterol level. So injectable to bring you down the cholesterol level, to bring down the cholesterol level. So using injections. Yes, using injections. So we were a bit surprised, because we thought we had reduced it by 50%. We must have done something right, and we are going in the right direction. Okay, may I know what was your level before, and then? I think it was around 7 thereabouts. 700. 7 points or something like that. 7 points. Okay. And so not like explosively high. It's not something very dangerous or something. Not very, very explosively high. So that was my sugar level, by the way. But I think there was a scale. You have good cholesterol and bad cholesterol. Before that, I didn't understand. I didn't understood there was
there was bad cholesterol and there's good cholesterol, and that there was a difference that you need, a margin that you need to be falling in between. So my bad cholesterol was rather a little bit higher, maybe about 5 or something. But then you didn't really factor in my good cholesterol. So the doctor looking at that, just looking at purely on cholesterol, a bad cholesterol level, decided that I should get more injection to bring down the cholesterol level. So that was the assessment. But we know that it could have some detrimental effect in the long run. So that kind of every visit, every time, even on the second and third visit, they were still looking at the levels. In fact, upon every visit, after the first visit, I reduced my cholesterol level by 50%. It went down to 25. And then even as it started to diminish, but each visit, we were being asked why we didn't want to get that injection. So we were like a bit puzzled as well. But of course, we didn't really inform the doctor that in the hospital that we have seek consultation from Dr. Lee, we have seek an alternative approach. So I think the main thing is trust level was very important for me. I think here we have a doctor that trusted our views. We resonated because they believe that it is possible that you can heal yourself naturally without the help of slowly moving away from medication, Western medication, and slowly moving towards your own natural healing. So here's someone that believes the same thing with us, that this is possible and that you don't really need to rely on medication for the rest of your life. I thought that message that came to me the moment I was ushered out from the operating theatre. I think that was one of the most depressing messages I have heard last year at least. I'm not sure if in my lifetime, but definitely last year. I thought that was not something very nice, when people were saying, how are you feeling, how are you good? But I said, you're going to depend on medication for the rest of your life. So that kind of was the sparkling moment where I knew that I had to find and prove him wrong. I'm not trying to be obstinate, but I think I heard and I believe that surely there's some other things that can be done.
Exactly.
Okay, there is quite a lot of therapies that I went through. And to be upfront, I may not remember exactly the name and the procedures.
Okay, I'll give you hints. I think you did the detoxification.
Yes, the detoxification is one. So that one process was basically helping me to cleanse my bloodstream as well. There were a lot of supplements that I took that actually helps improve my blood flow as well. Some oil in my body to improve the blood flow, and also one of the greatest finding I thought from was that when I first took a blood test over here or have a blood examination, I could see the molecules of my blood particles was actually quite cluttered and were quite sticky. So my blood previously was quite thick and it doesn't flow out quite easily. And of course, some could argue that it's due to the Western medicine that caused my blood to thin. But I choose to believe because from what I saw because I've stopped taking some of these Western medicine and moved on to the supplements, I could see my bloodstream actually improving such that it's now from a very dark red color moving to a very bright red color. So I suddenly felt that my blood combination has improved quite a lot over this whole, I think it was since November until now, it's about 5 to 6 months in the process.
It's the red blood cells, they were probably clumping together and all that. So I think now they're probably
separate, and it looks bouncy and it looks very healthy from a very black clutter and they were quite sticky. And of course, through the blood examination all the time, I know that my blood flow is much easier right now. So I think that's the first finding for my whole body. We did a lot of other examination. Another one that was recommended to me was through the dentist. So we had to remove the amalgam from the mercury from my teeth. That was something that was also totally surprised me as well, because I wouldn't think that was an issue all the way. It's something that the dentists do to us like a regular patient, but I didn't know that there could be some consequence because of that. So we totally removed it so that we prevent a possible recurrence due to high toxins or in my body and in my blood flow.
In conjunction with the removal, I think Dr. Lee has to give you something. That means it's not just removal, but sometimes I think after you need to come for a detox here.
Yes, that's right.
So something can be ingested in your during the removal process. Can you explain that?
It was some detoxification process. I think there was a drip, something that was plugged into me, and then you probably be there for a half an hour or so. And then subsequently you'll move into a sauna. You're doing some salted water, and just helps you to perspire and then to bring out all your bad particles and things out from your body. So this whole process lasted for usually about an hour or so. And it be done quite regularly, I think. How I feel, it's actually quite I mean, if you're in a sauna, it's quite good a feeling having to spend some time inside there. But the impact of it, I guess you can't really tell from one session, but you could see it from the blood flow, the examinations that were, and the tests that was given out to me later on. Yeah, I could see from there.
Any intravenous nutrition, like the
I think so. I don't really know the name of that nutrition, but it's something that is yellowish in color.
Yeah. And then the IV chelation you did, right?
I don't remember.
For the heavy metal detox?
Oh yes.
It's a clear fluid.
Clear fluid, yes. That one was done, yes.
That one was done. And then the rest is oral?
The rest is mainly oral, mainly through supplements. A lot of oral one, oil supplements. There were some other like omega-3, mainly through supplements generally to help me to improve on my blood flow. I think generally on my blood flow and also my remove some of the toxins from my body.
Yes. And then what about the food? What dietary changes were done?
I think we have been aware since I was discharged from the hospital that we have a shortage of vegetables. So I'm not such a big vegetable eater, and I still continue to struggle eating a full plate of vegetables. I mean, just to have some vegetables is fine with me, but to have a large plate of vegetables, I think that's not possible. I don't think it's just for me, but I think for most people to suddenly see a large clump. So I think our fiber intake would be always a concern. We can't really feel it in, so we need some kind of supplements to help us to cover this gap and to fill up the fiber intake. So that's where the supplements come in to help me with that, because otherwise, normally I think just taking salad and things I find is okay for me. I changed my diet. I'm a very big carb eater, so I like a lot of carbohydrates like noodles, rice, and things like that. So it's become more aware of it. From the visit with Dr. Lee, I become more aware of it, and I start to cut down on the carbs intake. We always have consultations, so always talking about my high level of cravings for carbs and how to reduce this craving for carbs. So I guess it's a process. I think a lot of us will find a sudden change a little bit difficult to adjust to. So if you just suddenly change and tomorrow you don't take, I think, but a gradual process, I think we can move on. Like you take from maybe a bowl of rice to maybe 3/4, and slowly you start to reduce your intake. I think those are things that we can try to adjust to. But I, of course, at the end of the day, when you see your medical results starting to improve and they are moving in the right direction, then you probably start to understand your own body system a lot better. And you start to know what are the causes for your problems. Or in my case, the cardiac arrest and the diabetic problems that I had.
What about any physical therapy, like exercises, specific exercises?
Oh yes, of course, hand swings, those help quite a lot. But I've been also, I managed to find time to also walk on a daily basis. We do brisk walking on a daily basis. So Dr. Lee has also encouraged us to do a little bit of HIIT and some other more intensive exercises, but that's a slow process. But I think generally very simple exercises like hand swings, which we can do in the office during office hours, or even before you step out of the office, or when you're alone, or when you're free, or when you're watching your leisure time, when you're watching TV. So these are things that you can do on a daily basis, even if you find it uncomfortable to walk or do things like that. I think we also did some lifestyle changes. 5 major changes that I think I went through. I think I quit smoking. I quit alcohol, quit drinking. I start to wake up earlier and start to sleep earlier and also wake up earlier. So that's another lifestyle change. Another one is dietary. So I start to control, eat more vegetables, ensure that I have a vegetable in all my dishes. And finally, you add it up with more exercising. So I have not been exercising, but then now I start to do exercise daily. So that became a routine. These 5 changes became a routine for me.
Sunlight exposure?
I think it's important. So during our walk, we get a lot of vitamin D from naturally. I think it's in Asia we are fortunate that we get a lot of sunlight. So that's not a major issue. We have to travel at least 4 to 6 hours just to move from our home to the customs, and the customs over to Kuala Lumpur, to Petaling Jaya per se here. And of course, then we don't have an apartment here, so we have to be in a hotel and put up for usually about at least 2 days, 2 to 3 days, and you plan. So you personally, you got to plan your work, and then coming over here. So there's some level of commitment that I think you need to be determined that that you want to solve your own, find the root cause and solve your own problems. So while there are challenges that we face logistically, that we have to give up some, plan out our time a lot better, and that we got to travel 3 or 4 hours. We take it like some kind of short break, or it's just like a weekend. You have a Saturday or Sunday, 2 days as well. We spend it meaningfully, but of course we have to push it on a weekday. So we adjust our working time, or some of our projects and our jobs. We do it on a weekend and we push it on a weekday, and we try and plan it such that we are able to come here for 2 to 3 days. We take it like a short break, but at the same time, during this short break, we also get to learn some things, some medical things about ourselves, our body. And we think that health, at least me and my wife, we feel that health is one part of our own work as well. Generally, if we can take care of our own health, we can continue to contribute, we can continue to add value. But if our health is weak ourselves, then I think all these can't stop. So it's part of work process as well, part of our work. So that's why we treat it quite seriously. And then we just, other than the logistics wise, I think traveling here, if you ask me, it's quite convenient. It's in quite a good location, surprisingly. It's quite easy to locate. We're just quite opposite 𝗏𝗏 medical hub, pyramid and the medical hub. So it's an icon by itself. So just, in fact, we usually will stay at 𝗏𝗏 Hotel and we just walk over. We thought that even walking over, there's a bit of exercising going on. And initially we didn't drive here, so we took a Grab and we thought, hey, just a short distance, why don't we walk? So then we started to change our habits and we walk over, and I thought it was just very convenient. It's very easy to find, not so challenging. So all these are plus points, the location of the clinic. So that kind of motivate us, other than like you have to go to somewhere very remote and that you have difficulty finding the place. So I think location of the clinic is important as well, in some sense, especially for overseas clients, where you need to find somewhere that's easy. So if you're somewhere from overseas, even if you're from Sri Lanka or you're from US or Britain, I think you can take it as you can find lodging here quite easily. You can find hotels nearby. And then you definitely no shortage of food choices. And you take it a short break and the clinic is just nearby. So it's quite easy to come here. So I don't see much of an issue for someone overseas to come here, other than they have to do planning and some job planning or things like that with their own work or their business.
You pointed out about the food choices. But you also still need to keep to your dietary. How do you manage that?
Well, I think it's fabulous here because we have a big mall. 𝗏𝗏 is a very big mall, so you have a variety of food. You will have no issues finding vegetables, salad, or things like that. There are some very good healthy choices. I'm actually wearing a CGM with me right now, so every time I monitor my sugar intake as well at all times. So we've kind of tested quite a few places in 𝗏𝗏, and the not so good restaurants and the better ones and the better coffee shops and things like that. We kind of find out after some time through trial and error. You kind of find out and know which ones are the ones that will not spike up our sugar level. So I think there are too many choices to choose from, and definitely there will be something that fits any culture or any nationality, because I think it's quite a big mall, so you won't have any shop for such food choices.
Amazing. You had a lot of your therapies were the supplements. And with your lifestyle, probably, how did you manage? Because you probably need to take it 2 or 3 times a day.
Yes, that's right.
Was that like a challenge that you need to carry them along with you and all those things? How did you manage that?
I think my first week was a struggle, definitely. Struggle to remember, because there are quite a few supplements. So I struggle to remember what to take. So I still rely very heavily on my wife to help me prepare all these. But once I just pack it in my backpack, and once I get to the office and you see it, the moment I leave it in front of me on my desktop, I think that helps me to monitor and know that I need to take it at some time. So that kinds of help. So it's just a little bit of having it quite conveniently in front of you most of the time. I think that kind of helps me to remember that I need to take it or when I need to take it. But if it's hidden somewhere,
because you tend to get lost in your work.
You tend to get too immersed in your work and forget about something else.
Precisely. Besides that, any other challenges you had during the treatment, if you can recall?
I don't think so. I think it's mainly time. You've really got to commit time.
Okay.
Like I said, I mean, for a local, I think it's much easier. Maybe it's half a day or something like that. You just take half a day.
Yeah.
But as a foreigner, you're traveling. You have to get accustomed for traveling time. And it's you got to plan at least 1 to 2 days. So I would probably think at least 2 days that you have to be off work to be treated.
Yes.
So that's just a bit of commitment to your own health.
Yes.
So other than time, I think the rest is just follow whatever the doctor tells you. Follow the instructions. If you have strong belief in natural healing therapy, if you don't want to rely on Western medicine for the rest of your life, I think that's this is the solution.
Yes.
I think my energy level is much higher. I thought I'm more productive at work generally than before. Definitely my energy level has improved. So I'm doing more than I was supposed to do. I can stay awake, more alert at more times. So those are the kind of things that you can feel. But I'm also very happy with the way my blood cells have improved. I think that's another testament to my own medical condition and my own determination. Diet-wise, I'm still trying to improve on. I still have cravings now and then, but of course it's not as much as it used to. But I think I can manage it a lot better. So through the regular advice and regular visits. The important thing is I don't need to give up. I think I need to make changes, but I don't need to give up everything. I don't need to do it so suddenly, which I think for a lot of patients out there, it would be too sudden. Like you don't just suddenly give up your carbs intake or something like that, but you need to do something else. You need to take more vegetables before you take the carbs or things like that. So for other patients, I think those are the things that they can help you because I think for most of patients, the resistance level is strong. It's mainly because they are concerned and they're worried that you need to make an overhaul of changes within a very specific time. And you can't get your lifestyle suddenly need to change. You can't get accustomed to it. So even for me, I love to drink. I used to drink alcohol at least once a night or things like that. I mean, just cutting it, finding a replacement source with water or something. I think slowly, you'll see some modification and changes. And then just finding time to work out, which I never done. So so it's challenging, no doubt, but the commitment, you'll see the results if you're willing to attempt to it.
Yes. What about your blood sugar levels now?
It has been sustainable. So it moved from, of course, a risky level around 6 or 7 to right now about 4 to 5. So I think it has come down quite sustainable. So I'm still undergoing treatment even at this moment as I speak. So I still need to watch over my diet. But at least I know that I have moved away from the pre-diabetic situation to where I am right now. So I'm definitely moving in the right direction. So like what I mentioned earlier, that I've seen patients that rely on medication. All they had is they maintain at a certain level. There is no movement forward. So what I saw with Dr. Lee is that I am actually moving forward and improving. So there's a little bit of difference. One is just helping you to sustain. You keep your lifestyle, you continue drinking, you continue smoking, you continue doing anything, but and with medication, you just sustain it at a certain level. But you're not improving your situation. So for me, actually, I'm taking baby steps at a time and improving my own medication, my own medical condition.
Amazing. What about your cholesterol?
Oh, it has come down definitely. Every visit to the hospital, it came from 50% to 25%, so it keeps reducing by itself. And there is also a replacement of good cholesterol as well. So in fact, my cholesterol level is fine. The difference between my good cholesterol and bad cholesterol is less than 2. So actually the margin was within an acceptable margin. So I'm actually fine. So even in the last visit, my last hospital visit was fine. So we were also taking a back need injection. So actually my cholesterol level right now is under control. We don't have any more issues. But we need to continue to improve based on that level, because the moment I neglect on it, I might move back to my previous habits and everything can come back again. So I just need to maintain this level of discipline and commitment. The staff that you mentioned around here, they kind of make you feel very homely, the reminders about the visits and things like that. the doctor was someone that you can resonate with as you speak. I think, basically, I think language, besides just being language, I think being patient and being understanding. So when they understood why we are here and being able to resonate those other things. I think the environment is quite important around here. So I was very comfortable first when I visited the clinic here as well. And overall, the arrangement, the logistics and organization, get reminders before the visit, this and that does help in a way. Of course, my family helps me. My wife especially is very much the person that's in charge of all my medical appointments and what I take and what I should do. She's just very much the person in charge in my household. Her motivation and those are compelling reasons that help me to move forward, besides just being disciplined yourself and willing to make the changes.
Amazing.
I think you have to look at your own level of commitment that you want, your priorities definitely. I think for most people, it could consider that as a heavy investment. I think that but the long-term impact of not relying on medication, I look at it from if I will look at it as, I'm more like look at it from a P&L approach. I look at a replacement cost. If I'm going to rely on long-term medication, it's going to cost me a bomb as well. But if I can get myself treated much earlier and make a commitment in 1 to 2 years, and if I can resume and improve myself and get to become back in the normal condition, I'll definitely save a lot more in terms of savings. So I look at it from that perspective. But also I look at it that you can't really price treatment in that sense, because it's how much you want for your own self. And that's why we are willing to invest in it's the same as I invest in real estate or invest in stocks. You also need to invest in your own health. So in this case, I'm investing in my own health just in order for me to be able to do a lot more things. So I look at it from a more holistic kind of picture, and not because I couldn't make a claim from insurance, or from like in Singapore, we actually could use our CPF or medical savings for such treatment. But of course, being in Malaysia, I can't use the money in my CPF MediSave account here in Malaysia. So those are things that I have thought about, but I don't think it came across to me that as a critical issue. I think the most important thing is whether there's somebody who can help us to deliver this value. We could have, I think surprisingly, we could have gone with someone in the United States as well. We thought we were very close to choosing somebody there. We thought that was another holistic doctor. But I think mainly because of some research that we did, that we realized that that's not really in the same direction that we're going.
Okay, fantastic.
I believe strongly that there is something else that people are unaware of, that if you do a bit more research and you spend a little bit more time, that you can find out. So for a lot of patients out there, I think generally we are patients, so we're not medically trained. So if we go to a hospital and we're ushered in, the other thing that you can only rely on is the doctor's advice. And I see that with my friends and my colleagues as well. But I don't see them improving. So there are medical conditions are maintained, I should say sustained, but I don't see any improvement. So they're not moving forward. They're just either stagnated or maybe they're just prolonging, reducing the pain, or we don't know. Maybe it's just sustaining at a certain level, and every time they go back to the doctors, it's just sustained at a certain level. But there's no movement forward to improve on their health condition. So I thought by taking medicine and just following that, I look at their examples. I have colleagues with gout problem, thyroid, all sorts of issues, heart issues as well. Even my brother-in-law also recently collapsed with high blood pressure and things like that. So all these issues, and I started to examine, I realized that they continue to rely on Western medication. So they continue to return to the hospital, but nothing changes. They still have reoccurrence once in a while. Nothing changes. So every time it occurs, they go back to the hospital, they take the medicine. It stops for a while, but a few months or maybe a year or two later, it comes back again, and it keeps repeating itself and itself and itself. Is that the life that you want to lead? You gotta frequently visit the hospital and become a regular visitor, or is there another way that you can get out of this whole vicious cycle and pull yourself out? So that is the real benefit. I thought that the public should know that there is really some other solution. I think you need to know what you can eat and what you should watch out for. I think in the past, I'll just go with what I feel like doing, whatever I see, whatever like, go with taste basically. Yes. Let's start to be more aware that the way food is being prepared, the way it's being prepared for us, it's really to increase our cravings. The way processed food are being done. These are food that sometimes we see daily. We see probably in the coffee shop, in the restaurant. It's everywhere around us. And they're prepared in a certain way. If it's tasteless, I think generally the business will not be good. So we also have to understand that. But we have to take care of ourselves and our body. So the education behind is really to watch over. The main education, I think, is to really know what kind of food that are good, what kind of food that we have to eat less. Even the education on oil, there are good oil and bad oil. So I was quite amazed. I thought oil is no good. So it's like some type of oil that actually good. Salt. I would start to think that, hey, as someone with cholesterol level, I should be taking less salt. But I realized that there's also some fine salt that is actually quite good for the body. So these are little lessons that I learned. Mostly, I think, related to dietary, other than the exercise and what kind of exercise you can do. But mostly related to dietary, so they can be more watchful of the food you eat. Because what you consume, if I can relive my life, I think the main thing is to understand that what I consume, what I put into the stomach is the outcome of what I intake every day. So if I just allow myself to go loose and just take anything, just eat whatever I like. And just like if I have to take soft drinks or bubble tea every day, naturally there will be a consequence to that problem later on. So I think we all have choices. So if you want to be just living a normal life and be more energetic and be able to do a lot more things with your life, I think those are the choices you can make, and just be a little bit more watchful. I don't think you need to give up everything, but you can be a bit more watchful over what you have and be a little bit more concerned not to take food that's too oily or too salty or too sweet.
Amazing.
You need to understand your life priorities. You need to make a commitment that you want to improve yourself. If you feel that you're fine, that you just want to remain in the same condition, manageable condition, and that you will have occurrence and reoccurrence of the same health conditions over time. That means from now until the day you leave this world, that you continue to have these symptoms and continue to live on medication, and you're not committed to find a solution. I think then it's about choices. So you really got to figure out what you prioritize yourself. And for me, I think I just want to make sure that I live a more fruitful life. I think for the rest is, do you want to be in the same situation of relying on medication for the rest of your life? I think that same doctor's message that came back haunts me all the time. It's just like, you are going to rely on medication for the rest of your life. Is this something that you want as a person? Is that how you're born to be? You're born to take medicine for the rest of your life? I'm not sure. I'm not sure if it does hurt someone or haunt someone else as badly as it haunts me. So this is the main thing that I want everybody to think about. Is that really the kind of situation you have agreed to accept it? That this is how life should be, that I'm gonna take medication, and just by taking medicine, I'm just maybe just helps me to maintain that same level. And not forgetting that there could be some side effects as well. One medication could lead to other problems, and other problems. As we know, these are all drugs in a way. I perceive it as drugs in a way. I think I look at our whole body system like a piping system in our whole body, our vessels and how it's being connected. We need to know where the actual problem starts from. So it could be maybe here, it could be here, it could be here. But by just taking medicine, it's just trying to, it's just like in a whole pipe, you just pour a chemical in and you try to agree to flush out. But maybe that was not the problem. Maybe the problem was because there was a crack somewhere along the pipes. But where is it? Where's that crack along? Which part of the building is it that you have that crack? But just by solving one, maybe it does temporarily remove the pain. It does ease off that solution, but it's going to come back. It's going to haunt you again and again and again. And I could look at this as a situation where I have colleagues who have gout problem, and they have gout, and it kind of once a month they will have pain, and sometimes the pain is so unbearable they can't get up from the bed. and they take the medication, they feel better.
Yes.
But next month, the same problem comes back again. They take the medicine and they feel better. And the next following month and so forth. And it keeps coming back and back and back and back. And that's how they're going to leave it for the rest of their lives. So without finding the root cause of their problem, it could be the diet, it could be something. And without having the determination to move forward and make a commitment to change, this is the life that they're going to lead for the rest of their lives. I don't know if maybe they are comfortable with it, but how about the inconvenience that's caused to their family members and their loved ones? And why am I saying that? It's because they're already inconveniencing me at work, because there has to be someone to replace them at work, who feel the same task. And they'll be of lesser value to society, to themselves, and they're actually doing a disservice to everybody around them, other than just themselves. So by not even taking care of their own health system, actually the impact is not just on you. A lot of people around you, your family, your colleagues, your staff are affected as well. So I would encourage people to try and find the solution to the cause of their problems.
Okay.